Hi and welcome back to Coffee Brains. I'm your neurologist, Dr. Serdan, and I'm here to bring you your daily neurobrew. Today I want to talk to you about the two things you should never do when somebody presents with stroke symptoms. If you recognize this, if you're like at home or somewhere and one of your family members starts having stroke symptoms, you don't remember that? Okay, well, I'll quickly summarize that. If by any chance somebody has a facial droop or vision loss or double vision or slurred speech or right-sided weakness or left-sided weakness or numbness in one side of the body or gait instability or severe vertigo, like severe dizzy state, if somebody has that, then that patient may be having a stroke. Well, one of the huge mistakes that I've seen very often actually is that patient's family give them aspirin, and aspirin actually can make things worse. And the reason why is because what you're recognizing as a possible embolic or ischemic stroke is not an ischemic stroke, it's a hemorrhagic stroke. And if actually a patient is having a bleed in the brain and you give aspirin, that bleed is going to get worse, and the patient is going to get worse and actually may die. The mortality rate increases, right? So you should never ever give aspirin to somebody that looks like he's having an ischemic stroke, because they may be having a bleed. And the second and most important thing too, you should never take these patients by yourself or in a personal vehicle like a taxi or so to the emergency room. It's gonna take longer, and time is brain here, guys. You need to call 911 and get an ambulance, because that's gonna be faster, number one, and number two, they're gonna be treated even faster in the emergency room. Why? Because if you go with a personal vehicle or a taxi service to the emergency room, the triage service may not recognize what it looks to be a stroke, and instead the paramedics will, and they're going to take him faster to the emergency room. The emergency room physician is going to be even advised. They're gonna receive an alert by the paramedics when they're en route that they're having or may be having an ischemic or a hemorrhagic stroke. They're gonna activate the stroke alert before the patient arrives to the emergency room, and the management is gonna be faster. Okay, so always call 911. I hope you like your daily neuro brew, and I'll see you tomorrow. Stay safe. Bye.